So you'll be able to see me now quickly. Yeah. So I was talking about there were 24 questions which have come from from pathology in INICET. As I had assured you, most of the questions are from notes. So I was talking about there were 24 questions which have come from yeah. So almost all, only one question which was not directly from the notes. Okay. Yeah. So I'm able to see now. So let's look at the question. Question number one. Question number one, this was, which of the following is not inherited or isn't inherited? Which is not inherited was given. And homocystinuria, no. Protein C deficiency, antithrombin C3 deficiency, PNH. PNH, we all remember, we studied this in the class. It is an acquired mutation of PIGA gene. If anybody remembers, in the class test I had given about PNH one question. Even in TND there was one question, and which of the following are true all except I had given. And in that, two confusing things which people get confused. One, it is an inherited mutation. I had given this option in the class test, inherited mutation of PIGA, and that was a false statement there. It is not inherited, it is acquired mutation. It is acquired mutation. TTP, not a component. Yes, in TTP, what is not a component? Yes, thrombotic, thrombocytopenic purpura. So in TTP, there will be, yes, what will be there in TTP? We say in TTP, it is HUS-TTP, by the way, isn't it? Hemolytic uremic syndrome and thrombotic thrombocytopenic purpura. So in this best, okay, there will be microangiopathic hemolytic anemia. So this is MAHA, which will show schistocytes. We discussed this in class. Renal failure, yes, it will be there. Uremia will be there, right? Basically, because of uremia will be there. Thrombocytopenia is also true. So these are all true. Answer, thrombosis. So answer to this will be plus minus. There will be platelet microthrombi that will be seen. Platelet microthrombi will be seen, not fibrin thrombi. Platelet microthrombi can be seen in TTP, right? HUS-TTP, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura. Next, question number 3. Again, this we discussed in the class. So what is this? The blood product not obtained by centrifugation. So which product will obtain not by centrifuging the blood? So if you remember, in the blood we said we divide them into yes, so we did not discuss in detail. I just want to give you a detail since the question has been asked. So we collect whole blood. How much whole blood we collect? Whole blood will be 450 ml we collect, right? And then we do a soft spin, we call it. So soft spin or a light spin, whatever word we use. So light spin will be, we do centrifuge at low speed. Once we do centrifuge at low speed, there will be platelet rich plasma, PRP, platelet rich plasma, and packed RBC. So you get packed RBC. Now we take this PRP, then we do a hard spin. So what is a hard spin here? We do a hard spin. Hard spin will be with high RPM. This will separate, yes, this will separate the platelets and the plasma, and FFP will be coming. And this FFP at 4 degrees Celsius, we do spin again at 4 degree, then we get a cryoprecipitate. Right? So cryoprecipitate requires a spin, plasma requires a spin, RBC requires a spin. What doesn't require a spin is a serum albumin. So if you want to get serum or its component, so simple. What do I do to get the serum or its component? Allow the blood to clot. That's it, right? That should be the one. Okay. Yes. Next, most common cause of inherited coagulopathy. Again, we discussed so many times in the class. Answer to this is factor 5 leaden mutation. So what happens in factor 5 leaden mutation? There is a missense mutation of a factor 5, and because of this missense mutation, factor 5 becomes resistant to proteolysis. Factor 5 becomes resistant to proteolysis, by protein C, isn't it? So normally your protein C should have been what? Lysing your factor 5, and now there will be no lysis happening, right? That is what is the pathogenesis of factor 5 laden mutation, which will present with thrombosis, right? Yes, so answer was C. Next, question number 5. Yes, this was a question 5. Which of the following should be done? This is what recall I have got. So let me check what was the exact recall here. Yes, which of the following? Just a minute, guys. Yeah, so which of the following should be done? So this was the question asked, should be done. Most of the people have recalled this as should be done. So anyway, if it was should not be done also, the answers will be opposite, by the way. While drawing blood from serum for serum calcium levels. This was the question asked. Yes, and it was a multiple true false. Avoid exercise before fist. Okay, avoid exercise before making fist. So this was not there in the option. Leave this. So you have to avoid forearm exercise was also given. So avoid exercise or forearm exercise before making a fist. Nothing, no problem. This is not required. I mean, this is not advised. So question asked is which should be done. So avoid exercise should not be done. So this is false. So if you do exercise, no problem. You don't do exercise, no problem. Tourniquet should be released as quickly as possible. Yes, this is true. For any sampling, tourniquet should be released as quickly as possible. Yes. So how is this tourniquet? Why tourniquet should be released? So if you had attended my TND, this question I had put about the blood sampling. Let me just brief you about the blood sampling. How do you take? First, what do you do? Match the patient details. Two details should be matched. Two independent parameters should be matched. That is name. Usually we ask name and date of birth, or name and age. Anything, right? Two different parameters should be matched. Do not match first name and second name. No. So name and usually date of birth or age should be matched. And once we match, then what? Try to identify where. So antecubital fossa commonly. So first is palpate. Okay, palpate there. Make a fist. Palpate. Try to palpate the vein. Okay. So once you palpate the vein, then sterilize. So not sterilize first and then palpate the vein. Then you're going to contaminate the wound. And so then what? Tie a tourniquet. Sterilize, then tie a tourniquet. Vein becomes very engorged and will be visible. Nowadays we are having a torch like this one, where vein becomes more visible, which is then so we can use a torch also to identify the vein. Then insert the needle. Angle should be less than 30 degree. Less than 30 degree. This question can come in exam. Once the blood flows, release the tourniquet. So very, very important. When to release the tourniquet? Release should be once blood flow is established. Not, yes, this can be question asked. Once the blood flow is established, you have to release the tourniquet, and it should be preferably less than within 1 to 2 minutes. Maximum is 2 minutes. Some books mention it 2 minutes, but some book mention it only 1 minute. Why is it important? Because longer you tie tourniquet, when you have compressed the veins, there will be congestion happening here. Obviously there will be congestion happening, and because of congestion, increase hydrostatic pressure. If hydrostatic pressure increases, two things will happen. One, so once the hydrostatic pressure increases, there will be movement of water out. So water starts moving out. If water starts moving out, concentration of the electrolytes and blood sugar, etc., will start rising, obviously, because water is moving out of the vessel, and that is why you can end up having an abnormal values. So remember, you have to release the tourniquet within 1 to 2 minutes only. Now important, if you cannot release within 1 to 2 minutes, that means you are not able to what? Establish a blood flow. Release the tourniquet, wait for another 2 minutes, and then tie another tourniquet in another hand or in the same hand. If you're doing it, should be repeated after 2 minutes. That is one. Second, ideally prefer for electrolyte, prefer not to take in the needle and then empty it into the container. Usually use the vacuotenus. All these vacuotenus will be having vacuum inside, and now if you remember, there is a special type of needle. When you insert there, then what? With the vacuum suction, blood flows into this. This is the best way rather than manually taking through the syringe. Why? When you take through the syringe, then when you are passing it into the bottle again through the syringe or without the syringe also, there is a chance of hemolysis happening, and if hemolysis happens, then hemoglobin will drop in the patient. Your abnormal values of hemoglobin will be there, and hemolysis happens, potassium etc. can be abnormal. So that should not be done, right? Yes. So next is one more is citrate and oxalate are used as an anticoagulant. This is a false statement. Citrate and oxalate calcium chelators, EDTA, citrate oxalate should not be used for calcium levels. So any electrolyte, what will you do in electrolytes? Most, yes, green vacutainer, heparin, followed by, or if not available, you can use golden yellow. Golden yellow will be serum tubes, right? Golden yellow or red serum tubes can be used for any electrolyte. This was also a question later on. Bedridden patients have increased calcium due to bone resorption. This is also true. Bedridden patients will be having increased calcium because of, and this is also yes, so there will be a hypercalcemia happening. That is also true. So in this, 2 and 4 are true. So option is C in this. Option is C. Next, question number 6. Anticoagulant used for HbA1c is sodium fluoride, citrate, oxalate, EDTA was given, right? So these were the options that were given. Answer is not sodium fluoride. Anyway, sodium fluoride is not an anticoagulant. Remember, sodium fluoride, what is the role of sodium fluoride? It is a glycolysis inhibitor. So glycolysis inhibitors are required for blood sugar, not for HbA1c. See, if glycolysis continues even after collection of the blood, that means the blood sugar will start what? Dropping. And since blood sugar is a single measurement, today's value or right now, what is the value of the blood sugar? Whereas HbA1c is not a instant value, it is an average for the last 3 months. So I don't want, even if glycolysis continues for few more minutes, even after what? Taking the blood, that doesn't matter for HbA1c because it is an average of 3 months. Another few minutes or a few hours, if glycolysis continues in the RBC, your HbA1c is not going to be affected significantly. So we do not use fluoride for this. Sodium fluoride is used for blood glucose and alcohol estimation also. Alcohol estimation as well. So next is citrate. No, we don't use citrate. Answer is EDTA. For HbA1c we use EDTA, not citrate nor oxalate. For blood glucose, actually blood glucose we will be using potassium oxalate plus sodium fluoride. This is what is there in the gray tube, right? So this will be in gray tube. This is for blood glucose, not for HbA1c. So EDTA is used for HbA1c, right? Next, in a stored blood, the oxygen dissociation curve is, yeah, lavender color. So the option given was not lavender, it was yes or purple, whatever word you use, lavender or purple color. Lavender color or purple color. Okay, so in the stored blood, oxygen dissociation curve is, this was the question asked. So what happens in a stored blood? If you remember, in a stored blood, there will be the concept behind this question, there will be decrease in 2,3-DPG in the RBC. So if there is a decrease in 2,3-DPG in the RBC, this leads to increased oxygen affinity. Because increased oxygen affinity, there will be decrease O2 delivery to the tissue. This is what we had discussed, isn't it? Yes, to the tissue. Decrease in oxygen delivery to the tissue and increased oxygen affinity to the hemoglobin means this will lead to shift to left. And there were two. Okay, so options given were like this. So they had given A, B, C, D, E. First thing is oxygen dissociation curve will be a sigmoid curve and not this. Of course, answer will whatever is shifted to left, but one was a straight curve. Straight is not the answer, so it will be shifted to left, which is a sigmoid curve. And here it is option A. Option A in this, right? Next, which of the following is not a germ cell tumor of ovary? One question, one liner question, not a germ cell tumor of ovary. Dysgerminoma, yes, it is a germ cell tumor. Granulosa cell tumor, that is a correct answer. Granulosa cell tumor is a sex cord stromal tumor of ovary. We discussed this about the classification of the ovarian tumors. I told you it is very, very important. Examiner will give these questions in exam. And granulosa cell tumor marker will be inhibin, right? Yes. Next, genes involved in epithelial mesenchymal transition. So what is involved? Answer to this question. This again we discussed. EMT was the first step of invasion and metastasis. In the class notes we already have it. Answer, twist and snail gene. MMPs, no, MMPs will help in not EMT. MMPs will help in invasion into basement membrane, right? Yes. Cathepsins, no, cathepsins are not nothing to do with neoplasia. Cathepsins are to do with killing, non-oxidative killing. TTF, thyroid transcription factor, this is a marker for thyroid tumor as well as lung tumors as well. Next, question number 10, which vial is used for serum electrolyte was given? Which is used for serum electrolyte was given? Yes. So serum electrolyte, I told you already, we discussed green more than. Green tube is what? Heparin tube. So green is heparin. We have to use, if possible, use heparin. If heparin is not there, then we can use serum tubes. So serum tubes will be what color? Serum tubes will be red or golden yellow. Word golden yellow is important, not just yellow. Only yellow will be ACD. Only yellow will be ACD. Yes, there were two curves towards the left hand side in the question, but one was a straight curve which was like this. This is not. This is a straight curve. No, oxygen curve will be a sigmoid curve, right? The sigmoid curve which is on the left hand side, that is the correct answer. Yes, correct. In green sample we use, yes, green is best for electrolytes. Yes, best. Okay. Word serum was used or not? That is important. So word serum was used or not? Because yeah, so if serum was used, okay, and in this I have printed it as serum, so I do not know, was it serum electrolyte or just electrolyte given? That will decide. If it was serum electrolyte, then answer will become yellow only. Why? Because if you want to get if you add heparin, you will not get serum. So yes, I have okay, so what I got to know was serum I have added here, sorry. So only electrolyte was given in the question. Yes, so if it is for electrolyte, okay, so if it is for electrolyte, green more than red, okay, the blood electrolytes we can measure. Another is, if your specific question was if it was serum electrolyte, then answer will be serum tubes, that will be yellow color. That will be the correct answer. Serum not given, yeah, that is why. So only electrolyte was given. For electrolyte, answer will be green then. So if only electrolyte was given, then the answer will be green. Word serum is, if it is used, then it will be yellow or red color. Okay, because if I am adding heparin, I will not get serum, right? Okay, next question number 11. So a patient presented with umbilical cord bleeding, PT, APTT, TT are normal, and there is lysis of clot with urea. So lysis of clot with urea, examiner is telling this is a urea lysis test. Urea lysis test. So urea will lyse, yes, urea lysis of the clot with urea suggests it is unstable clot. So whatever clot has been formed, it is getting lysed with 5 molar urea. That is an unstable clot. Two curved line on the left, see again, if it is had they mentioned any normal thing, because if I consider this red curve, there are two on the left hand side, by the way, so I am not interested in these two. So whatever is one, if they have not mentioned normal, I will be taking this one as normal here, and this is your shift to left, right? Okay, so there were, yeah, so the one which is shift to left, that is there. Okay. Okay, so next question was, okay, so urea lysis test, 5 molar urea will lyse unstable clot. If it is a stable clot, it doesn't get lysed. So answer is factor 9 deficiency, no. Factor 9 will have elevated APTT. Von Willebrand deficiency, no. This will also have elevated APTT, can have APTT elevation. Factor 13, yes. So all times are normal and patient is having increased bleeding. That is the only answer. Factor 8, no. Again, there will be elevated APTT happening here, right? So answer is option C for this. Next. Next is question number 12. Let us look at what is the question factor 13. Yes, correct. Factor 13 deficiency. A 5-year child presents with fever, hepatosplenomegaly. Bone marrow shows blast. So, I do not know whether blast image was also given, but flow cytometry was definitely given, is as follows. So, I already had told you how to interpret. So, this was TDT and 22 has been given, CD10 and 19 has been given. So, let me start interpreting. Okay, so this column will be both positive. Yes, this is both positive, if you remember. Yes, and this will be positive for y-axis. So I will write y positive but x negative, right? So this will be on y-axis, whatever is a marker, that will be positive, but x-axis will be negative. So these cells are CD19 positive cells, but they are negative for CD10, isn't it? Because they are before this, right? CD10 negative these are. So that means there are many B cells which are negative to 10. That means these are not precursor B cell, but there are many B cells which are either precursor or germinal center B cell. Next, 22 and TDT. So 22 is a B cell marker. So this will be again both positive. So basically the cells are positive for CD19, CD22, CD10 and TDT. 19 and 22 are B cell marker. 10 and TDT are precursor marker, right? So that is why diagnosis is BALL. Okay, blast image was also given. Okay, I will incorporate that blast image as well. Okay, blast image was also given. Okay, so this is the diagnosis. So diagnosis is BALL. Blast image was also given. I'll just add that as well. Next, not a feature. Question number 13. Not a feature of men 2B was asked. Men 2B. Again, men syndrome. We discussed this in class. Most important is men. In men syndrome, marfanoid habitus. Men 2B will have marfanoid habitus. Not the answer then. So this is not the answer. Mucosal neuromas, ganglioneuromas will be there. That is also there. Parathyroid hyperplasia, no. So parathyroid hyperplasia will be seen in men 2A and men 1 also. You can see parathyroid lesion, not in men 2B. Medullary carcinoma can be seen. So in men 2A also you can still see medullary carcinoma, right? So answer is option. Okay, not seen, that is a correct answer. Sorry. Yes, not seen, that is a correct answer. Okay, the previous question, how to interpret. Interpretation, look, whatever is a marker on the x-axis. Okay, let me try to explain you. This line that is there showing, the red arrow mark that I have shown. So yes, on the left of this line, it is a negative marker. Whatever is this marker, negative. On the right of this line, whatever is this marker will be positive. So now look at this. These cells I am talking, tell me now, all these cells that I am talking, they are beyond this line, isn't it? That is why they are positive for TDT. They are TDT positive, isn't it? And now look at the blue arrow mark that I am pointing. This line I am talking. So this blue arrow mark, above this line will be positive for this marker. Below this line will be negative for this marker. Simple. So that means again this group of cell which we are talking, these are also positive for CD22. Look, a small minority of the cells are here. So what are these small circle that I have shown here? Please interpret this small circle that I have shown here. These will be, no, it can't be TALL and BALL are not given in the same options. They can't be giving that, because they had given 19 positive to 22 positivity, so they cannot be in the same option. Either they would have given BLL, TLL separately, or they would have just given ALL. Okay, so what is this small circle? These small circle that I am talking, yes, so these small circle I am showing with green, these will be CD22 positive, but they are not CD, TDT negative. That means these are not immature. There are some mature B cells also present in the, yeah, mature B cells are also present in the blood sample, but majority of them are immature B cells, isn't it? Same thing is reflected here as well. Some cells are, so this green circle I am showing, these are CD19. Yes, these are 19 positive. These are 19 positive, but they are 10 negative. 10 is a precursor marker, if you remember. And on the other hand, this blue circle that I'm showing here, these are both 19 positive and also 10 positive, isn't it? Yes. So this is how you'll be interpreting them. Okay, question number 14. Question number 14. Match the following genes with their condition associated. APC, SMAD, SKT11, TSC. Yes, sir. APC, SMAD, SKT11, TSC. You can start with any one of them. TSC. I will start with TSC. TSC is for tuberous sclerosis. So D is 3. So I look like this. D is 3. 3 options are there. Option B is ruled out. SKT11 is for Peutz-Jeghers syndrome. C is 2. C is 2. So that means this option also got ruled out. So next is I have to now know A and B then. So APC mutation, easy to understand. APC mutation is for familial adenomatous polyposis. So answer is option A. Option A is the correct answer, right? Next. Yes, so there was a TSC given, and that's why I start with easier one always. Test used to detect aneuploidy. This was a multiple true false type of question. Test that can detect aneuploidy. That was the question, right? Yes. So they had given PCR, fish, and was it given as a conventional cytogenetics or karyotyping, either of them? So most of the students told it is a conventional cytogenetics and Sanger sequencing. So in this case, yes, two best investigations we will do commonly to detect aneuploidy are fish and cytogenetics. And even in the class I had asked this question, for aneuploidy which is the first test to do? Karyotyping, followed by what? Fish, because fish is very, very specific. You have to first do karyotype followed by fish, isn't it? So 2 and 3, option C is the correct answer. Option C is the correct answer. Next, question number 16. All options are given. Yeah, 1, 2, 3, 4 was also given, but that is not the correct answer. Okay. Yes. Next, question number 16. What is question 16? Let me look at question number 16. Match the following tumors and their markers. So they had given tumors with their marker. Yeah. So for aneuploidy, first you do karyotype, subsequently confirmation by fish. Okay. Choriocarcinoma, hepatoblastoma, medullary thyroid carcinoma, pheochromocytoma. I start with anyone whichever I know. I know choriocarcinoma. Choriocarcinoma is beta HCG. So A is 4. A is 4. So A4, I am ruling out 2 options. So A is 4. Then next, hepatoblastoma. Yeah, hepatoblastoma. Even if you did not know, you can go to the next one. Medullary carcinoma of thyroid is calcitonin, C2. So C is 2. C is 2, but this already has been ruled out. So now this is also ruled out. Answer is option A then. Hepatoblastoma, alpha fetoprotein. Both HCC and hepatoblastoma, hepatic origin tumors, will show alpha fetoprotein, and beta HCG, pheochromocytoma, catecholamines will be there, right? So that is what is the correct answer now. So answer is option A. Option A. Again, we discussed all these markers in the class. See, I am telling you, everything was discussed in the class. Until now, whatever we have discussed, all these had come in, we had discussed them in the class. Everything until now have come from class notes only. Everything that we have discussed until now. There is one question plus minus from class notes, but if you had understood well, you would have easily ruled out that. That's it. So which one of the following represents sickle cell anemia changes? So changes correctly. So that is what it is. Sickle cell anemia changes correctly. And from yesterday onwards, I have been getting that there are students who have scored 100% strike rate in pathology just by class notes DVT. That's more than enough. And from that, they have scored 100%. And even from if TND somebody has attended as well. Then next, so which of the following represents in sickle cell? If you remember from the notes again, in sickle cell, I had specified 3 things and examiner will give them and you will end up confusing them. This also I had told. So there are 2 things, 6th amino acid and 26th amino acid. Anybody? So what is the sickle cell anemia change is in the 6th amino acid, not in the 26th amino acid. In 6th amino acid, glutamate is getting replaced by lysine. No, glutamate should be replaced by valine. This is correct answer. This is your HBS. Now, tell me glutamate getting replaced by lysine. Option A. What is this? This is your HBC. And in 26th position, same as HBC, that is glutamate getting replaced by lysine. This is HBE. So these three expected in exam, I had told you. So HBS, HBC, HBE. One more, you just remember HBH. What is HBH? Hemoglobin H. Again, we have discussed this in class. Hemoglobin H is beta tetramer. HBH is beta tetramers. Beta tetramers seen in alpha thalassemia. There is one more, Bart hemoglobin. Bart hemoglobin is gamma tetramer. Both of these are seen in alpha thalassemias, which are rare in India. Alpha thalassemias. In beta thalassemia, we see alpha tetramers, right? Yes. Yes, I used to make this one. So glutamate good, glutamate was good, is replaced by villain. That is happening in HBS. Glutamate is getting replaced by villain. Okay, good is getting replaced by villain. And that is why HBS. I remember only HBS. Everything else becomes easy. Okay, next question. Question number 18. Question number 18. What was the question on cystic fibrosis? One question I got it in the match the following. Any other question was there? Please, you can just type. I can include that as well if any other question was there. Okay, match the conditions with the bodies. Okay, Parkinson, myeloma, malakoplakia, rabies. Everybody would have known rabies for easy. Rabies will show Negri bodies, D3. But examiner has given three options here. Okay, so then A is ruled out. Then myeloma. Myeloma will show Duchenne bodies, Russell bodies. Russell bodies and Duchenne bodies will be seen in myeloma. B1. B1. Okay, only one option now. Answer is option C. Okay, malakoplakia will show Michaelis Guttman bodies. C2. Correct. And Parkinson will be showing Levy bodies. A4. A4. Okay, next question. Not true about celiac disease. Again, so many times we discussed. Not true about celiac disease. Anti-TTG IgA are present. Anti-gliadin antibodies are present. HLA DQ, DQ, I think misprint here. DQ 6/11 was given. 6/11 association. That is a false statement. It is associated with HLA DQ2. DQ2 more important, around 85 to 90 or 90% cases are 90 to 95% cases are DQ2 and the rest will be DQ8. Around 10% cases are DQ8 association, right? Yes. Okay. Yes. So this is your answer. Marsh criteria is used for diagnosis. Yes. Next question number 20. A young man presents with swelling in, I think, forearm was given. Now I can understand. Forearm, this was the question. Excision was performed. Histological examination of the same is as follows. Which of the following is not true about the tumor? So this I've asked so many times. Yes. Even in test, class test, the subject wise test, you are having this TND also image. So what you are seeing, this is your Verroque bodies. Verroque bodies are schwannoma. Diagnosis is schwannoma. There are option A is correct. So this is true. What are Verroque bodies? The arrow marks that I am pointing, that is the nuclei free zone in between. They are the Verroque bodies that you are seeing, right? Associated with neurofibromatosis. Again a misprint. So these are all typing errors. Sorry. So associated with neurofibromatosis was given. Yes, that is also true. I mean, partly true. I would say it is associated with NF1 or 2. Yes, guys. Okay, modified Marsh. Yes, we are now using modified Marsh. Okay, that is also correct. Nothing wrong with that. Modified Marsh. Okay, tell me NF1 or NF2 association? NF2 association. NF2 will have schwannomas and meningiomas, right? Then metastasis is common. This is a false statement. It is a benign tumor. No metastasis happens. Arises from nerve sheath. That is also true. So answer is option C. B is also true then in this case, right? Yes. Next, match the following. Okay, this is what you are asking. Yes, match the following condition with their body, not body, sorry, condition with inheritance. This is inheritance. Duchenne muscular dystrophy, cystic fibrosis, Leber's hereditary optic neuritis, spinobulbar muscular atrophy. So were these the options? Yes, please confirm if these were the actual options. Okay, so in this I start with whichever I know. Cystic fibrosis or Duchenne muscular dystrophy. Cystic fibrosis is autosomal recessive condition. B is 2. Okay, in this only one option, sorry, B is not 2, B is 1, sorry, B is 1. So two options are correct. So these two are ruled out. Yeah, inheritance was given. Yeah, in the question NF, only NF was given, then also I will still mark it as correct only in the previous question. Okay, so then Duchenne muscular Leber hereditary optic neuritis is mitochondrial. C is 4. C is 4. This is correct. So answer is option A. Answer is option A. Okay, what was that question? CD28, CD40, PD1, PDL1, these will be immune checkpoint basically. So tumor escape. So CD28 binds with, CD28 is a co-stimulant. Normally CD28 will be binding with, please try to recall that question properly. Somebody has asked me this. Let me tell you what is this CD28 since you have asked. This is your T cell. This is your tumor cell, right? Tumor cell. So now this is on the T cell, there is a T cell receptor. On the tumor cell, there will be MHC. This is how we recognize, right? So MHC will be recognized by T cell receptor. So this is your tumor cell I am writing, and this is your CD8 cell, let us say. Now, so this is your stimulation. The co-stimulation is done by CD28. CD28 normally should bind with B7 molecules, we say. So normally, so B7 will be binding to CD28. So this is your co-stimulation happening. Co-stimulation happening. Needed for T cell activation was a question. Okay, thank you. Mechanism of convert. Okay, needed for T cell activation. CD28 is needed along with the B7 protein. So yes, okay. So what? Okay, question. Let us. I've missed that question now totally. This is new question that you asked. So CD28 is required for co-stimulation of the CD8 cell, T cell. Otherwise, T cell do not get activated. Both of them. Application of this actually in some of the tumor cell. What will happen is some of the tumor cell. So this is your CD8. So this is your T cell receptor. This is your tumor cell, and this is your MHC1, let us say. Some of the tumor cell produce another molecule called CTLA, and this CTLA engages CD28. And once this happens, CTLA engages CD28, so B7 cannot. So co-stimulation is inhibited, thus your T cell activation is inhibited. So this was the question, guys. Good, then this was again discussed in the class. CD28 is required for co-stimulation. CD28 is required for co-stimulation. Mechanism of conversion naive into a into a active CD8 cell, that is your by CD28. CD40 is required for the class switch. Okay. Okay, I will add this question as well. So this is question 25. I'll write it here. I have got only 24. This was the question. Okay, next question number 22. Yes, next question. Identify the structure. Was it mentioned as a prostate biopsy or not? I just want to know that. Examiner gave you hint of prostate biopsy, or just he had given identify the structure like this? Was there a prostate biopsy history given or not? And definitely I am able to see some glands here, by the way. I am able to see glands, and it is within the lumen of the glands. Yes, lumen of the glands. Yes, this is your corpora amylaceae. Answer is option C, corpora amylaceae, isn't it? Corpora arenaceae. This will be seen in pineal gland. It will be a, yes, pineal gland, which will be as what? Calcification. Calcification seen in pineal gland. Samoma bodies will be seen. Hint was given. Prostate was given, or a male genital something was given. What was the hint given? Prostate was given, or a male genital something should have been given. Okay. मल्टीपल करेक्ट आंसर था. एक और ऑप्शन साइटोकाइन रिलीज. Mechanism was asked here. Anushka, which was multiple type of question? The T cell activation which we are talking about. So the T cell activation we are talking about. Prostate biopsy 60-year-old. Okay, good. So prostate biopsy 60-year-old. Okay, so this is your corpora amylaceae. I do not know. I have just cooked up. See, option D, amyloid was given or something else was given. Whatever was there. I'm sure all of you have identified answer is corpora amylaceae here, right? Next, question number 23. Prostate was written, no. Okay, what is needed for T cell activation? Okay, you are telling me for this question, it was what is needed for T cell activation? Then PD1, PDL1 is also correct. If it is a multiple true false type of question, PD1, PDL1 is also correct, right? PD1, PDL1 is also correct. Let me just show you what we discussed in the class, right? In the class, we had discussed this already. PD1, PDL1, and we have, I told you this applied aspect of that. We have both monoclonal antibodies are also, no, PD1, PDL1 will inhibit the activation. So if they had asked which is needed for T cell activation, so okay, T cell activation which is needed, what were the options? Just want to know now. Let me say CD28 was the option, then CD40 you said, PD1, PDL1. PD1, PDL1 binding will inhibit. This will inhibit T cell. Inhibit T cell. And CD40, no, this is for class switching. Another option B7 should have been there. These will be activating. Okay, single correct type. Anyway, it doesn't matter. So even if it was a single correct type, answer is CD28. CD28. You could have ruled out at least CD40 for class which is there. PD1, PDL1 is for inhibition of T cell. And PD1, PDL1 is the one which is expressed by tumor cells. Thus, they inhibit the T cell activation. Right? Okay. Next. Which of the following is not a part of name syndrome in Carney complex? Did they mention word Carney complex or just they had asked name syndrome? So what is not a part of name syndrome? Yes, Nevi, atrial myxoma, myxoid neurofibroma, Epstein anomaly. Answer is option D. So that is not a part. So name will have A, B, C, and will have E for affiliates will be there. Affiliates. There is one more in Carney complex. In Carney complex, okay, Carney complex will have name syndrome, and one more is a Lamb syndrome as well. What is Lamb syndrome? Lamb syndrome, lentiges, cutaneous lentigens or lentiges. Then AM is atrial myxoma, and B is blue nevi. Blue nevi, Lamb syndrome. So there will be two syndromes that are associated with Carney complex, name and Lamb syndrome. Next, question 24. A patient presents with fatigue, neuropathy, post-gastrectomy. Word neuropathy was not given, I guess. So they had given tingling sensation in the legs. Yes, tingling in the legs. Tingling in legs. So I got this just now before recalling this. Tingling in the legs was given. Which of the following deficiency is he likely to have? Right? This was the question. Folic acid, no. Folic acid occurs after what? Jejunectomy. Vitamin B12 deficiency. Yes, that is a correct answer. Even iron can occur after gastrectomy, but because neuropathy is there, I will end up writing it as what? Vitamin B12 deficiency. Okay, they had given ataxia. Okay, yeah. Okay, tingling in the legs, wide based ataxia. Okay, wide based gait. Okay, right. Okay, Romberg's positive was also given. So it should be SCAD. ID, no. AD. Okay. Then the 25th question is the T cell activation. So I'll be adding that as well. So look, I keep telling this again. Pathology is very, very important. Patho, Pharma, PSM. These are the three subjects you take, whether NEET PG or whether INICET. You will end up getting 20 to 25 questions easily. 20 is minimum. Nowhere there have been less than 20. So, 25 questions will be coming from this concept oriented topic. So make sure do not miss any single point in the notes. All questions have come from notes. Yes. Okay. They are not given macro status. That is fine. That is fine. No problem. Okay. Yeah. So, but still gastrectomy history has been given. That is enough. Okay. Okay. So yes, these were the question. Yeah, patho. I keep telling this again. Patho, pharma, and PSM. Almost 75 question. Add OBG to this, it will become 50%. 100 questions will come from these four topics in any exam. Take NEET PG also. This will keep repeating again. So make sure concepts of these four subjects have to be well understood. So yes, any other questions which I have left behind? Please. I have taken all your questions. I hope all of you have got the concepts right and the answers right, by the way. Paper was not tough. And I will tell you one more thing. Patho and OBG are two subjects where your strike rate can reach 100% as well. You will end up getting, if your concepts are correct, you will get 100% questions correct. I've got so many students that I've got them correct. I've got them correct because most of the questions we had discussed either in Mission INICET or in the TNDs or in the class test or in all those. So the questions were, yes, if you want to be under 100, these four have to be strong, whether whichever exam you are talking about. You will be. Believe me, you will be. Okay, best wishes, guys. So, any further doubts I can take? Okay, best wishes.